Whether you're a pro athlete or just love getting out there on the weekends, a sports injury can feel like a total roadblock. But you know what? It really doesn't have to be. Today, we're going to map out the modern path that takes you from that sudden, frustrating setback all the way back to the game you love. It happens so fast, doesn't it? One wrong pivot, one awkward landing, and in a split second, everything just stops. You feel that pop or that sharp pain, and you get that sinking feeling in your stomach. It's something so many of us have been through. So the big question is, what do you do next? First things first, we've got to understand what we're actually dealing with. Think of an injury as your body's way of screaming that something has gone wrong. And figuring out what that something is, well, that's the very first step to making it right. We see a lot of the same culprits, right? That sudden twist that messes up your knee's ACL, which is so crucial for stability. Or maybe it's those repetitive overhead motions that really strain the rotator cuff in your shoulder. These are some of the most common showstoppers, and they all have one thing in common. They can seriously throw a wrench in your performance and your everyday life. Okay, so here's the million-dollar question. How do you know if it's just a minor strain that needs some ice and rest, or if it's something way more serious? Honestly, the most important skill you can have is just learning to listen to the signals your body is sending you. And you want to look out for these specific red flags. Did you actually hear a pop? Does your joint feel wobbly, kind of like it's going to give way when you put weight on it? Or is there a pain that just refuses to quit, even after you have been resting? These are not the kinds of things you just huff out. Nope. These are crystal clear signs that you need to get an expert to take a look. Let this one really sink in for a second. Pushing through constant pain isn't a sign of toughness. It's like hitting snooze on a fire alarm. Acknowledging that alarm system is truly the smartest and strongest thing you can do for your body in the long run. So, you've listened to your body, you've decided to get help. And here's the fantastic news. Modern medicine gives us these incredible tools to not only see exactly what's wrong, but to fix it with unbelievable precision. And a huge piece of that puzzle is arthroscopic surgery. The best way to think about it is like this. Instead of blowing a huge hole in a wall to fix some wiring, you're using a keyhole. A tiny camera gives surgeons a perfect view inside the joint, and they can make all the repairs they need with specialized tools through a couple of other little incisions. It's a complete game changer. And when you put it side by side with traditional open surgery, the benefits are just so clear. We're talking smaller incisions, way less scarring, and the big one, a much, much faster recovery time. The whole thing is designed to get you back on your feet and back in the game sooner. This is what that whole modern journey looks like. It's a really clear, structured path. It all starts with getting an accurate diagnosis, with tools like an MRI. Then, with that info, you get a personalized care plan that's tailored not just to your injury, but to your sport and your goals. From there, it's the minimally invasive repair, and then the absolutely crucial phase, guided rehab. You know, the surgery itself is really just one part of the story. The real work, the work that paves the road back to full strength and confidence, that all happens afterward. So let's take a look at what that road typically involves. Recovery is all about phases. Those first few weeks are just about protecting the repair and gently getting some basic movement back. Then you'll spend a couple of months really focused on rebuilding strength with your physical therapist. And then comes the exciting part. You start to reintroduce movement specific to your sport. So for a soccer player, that might mean light jogging, then adding cutting drills, and eventually getting back to working with the ball, all building up to a safe return to the game. And that 3 to 6 month window, that is a really key time frame to have in your head. Your comeback is a marathon, not a sprint. Sticking with your physical therapy and listening to your body during this time is absolutely essential for a recovery that's not just successful, but that lasts. And this right here is the ultimate goal. It's not just about fixing the injury, it's about getting back to your activity, feeling strong, feeling secure, and feeling ready to perform at your very best all over again. If you take one thing away from all of this, let it be this. An injury is not a life sentence. With the right diagnosis, modern surgery, and a smart rehab plan, an injury is just one chapter in your story. It is absolutely not the end of it. By understanding what's wrong, getting the right help, and really committing to the process, you are the one in the driver's seat. You are literally writing your own comeback story, and it all starts with the decisions you make right now. Because at the end of the day, the physical repair is only half the battle. Your body has this incredible, amazing capacity to heal itself. So the real question, the final question, is about your mindset. Are you ready to be patient, to be diligent, and to put in the work to make that comeback a reality?